Joining me on the show this morning is Paul Seegert. Paul is with PCS Advisers, healthcare advisory to businesses. Paul, good morning. How are you?
I'm doing great. How are you?
I'm doing fine. So would you agree that death and taxes, people around you die from COVID, being unvaccinated, that encourages your friends and those around you to go, wow, that guy died? Hell, I better get the vaccine. The other element is hitting you in your wallet. Taxes, right? So why should patients be kept financially unharmed for what will soon be, once they get full approval from the FDA, illnesses that are entirely preventable? The vaccine is readily available. It's free in a lot of parts. I don't think you don't have to pay for it at all. You just get the vaccine, you show up, and it's effective. Is that going to be happening soon?
Yeah, I think what we've seen is a lot of insurers who made patients, didn't make them responsible for any out-of-pocket cost if they had to get treatment related to COVID earlier in the pandemic, have let those policies expire. And there is some precedent that if you are in a higher risk group by choice, smokers is a good example, you can be charged a surcharge. I mean, since the ACA kicked in, there's been plans out there that do add as much as 50% to your premium share as a member of the plan if you're, say, a smoker, as an example.
No one is saying you can't smoke, but if you do, then there's a tax. Much the inverse would be true. Then, okay, we have vaccines available. If you don't want it, that's fine, but you're going to pay more, because what's the cost of someone who goes to the hospital, presents with COVID, winds up having to take bed space, God forbid, winds up going to ICU for a period of time, plus rehabilitation, all that. What are the price tags on that?
It varies widely depending on the facility, but we've seen charges as low as, say, $17,000, or charges into the six figures.
As low as.
It can be
That's a bargain.
Can you tell we're talking about healthcare today?
Yeah, anywhere from $17,000 and $17 billion. Well, depending, and it's just a hospital right around the corner too. That's the amazing part of it. And that's a whole other show. I know we've talked about that in the past, but price transparency and all that. But yeah, Paul. So and there's incentive there too, obviously, for mitigating risk, right? I think that when you look at, you mentioned smoking, but I think things like if you're a pilot. A lot of insurance companies say, hey, you got to get a different policy, or a rider at least. Same for, scuba diving, rock climbing, if you're a high wire walker, something along those lines. Firefighters are generally, they're insured differently. But, all along those lines, if you're in a dangerous occupation, very dangerous occupation, or you do things that are considered risky, they're going to gouge you. That's the market controlling things. Why would COVID be any different?
Yeah, it very well may not be, as this all plays out. I think one thing, though, that we do miss in this conversation, there's a lawsuit right now between a pretty high profile lawsuit, I guess, between a law professor and George Mason University, because he caught COVID, he recovered, and he has antibodies, and he got tested and has gotten tested multiple times since having COVID and recovering, and he has strong natural immunity. So that's an argument that could certainly work, and we'll see how this one plays out. But from a scientific standpoint, there is a basis for his argument. I got COVID, I recovered, I have durable, strong immunity. In fact, stronger than had I got some of the vaccines, like the J&J vaccine, wouldn't give him as strong of protection as what he has. So I think there could be some challenges that would be effective against it. Like that one.
Well, that makes sense to me. I mean, if you have natural antibodies, it's as good, if not better, than the vaccines. And we're back to that. I know we just talked about this a few days ago, Paul, is that we have to have more readily available, better advertised, and I think free, much like the vaccine, antibody testing, so we can see where the hell we are relative to COVID and who has the antibodies and who doesn't. I assume that the numbers, when they say 50% of Americans have received the vaccine now, that's all well and good, but what about the percentage of people who have developed natural antibodies? Is it now 60, 70, 80, 90% of the population that hasn't?
Yeah, that's the question I think we should really talk more about and go get an answer to. Mm-hmm. In the UK, they've gone out and randomly blood tested the population. I think we may have spoken about that.
Yep.
And found out that over 90% of the population has protection either from being vaccinated or getting COVID and recovering, which is why that Delta variant rose and fell so quickly. because they had a pretty high degree of herd immunity. Likely we do as well. We're having a surge here in terms of case count, but we're not seeing it translate in a 1-to-1 ratio to hospitalizations. We're still seeing hospitalizations that are below where they were at the peak. They're higher, but they're below, approaching 50% of what they were, but still below. And then the same thing for deaths. They're even less than that as a percentage compared to the peak, say running at 15%.
When we hear that kids are now falling ill with the Delta variant, Paul Seegert from PCS Healthcare Advisors, where in relation to the general population? Maybe you said, oh my God, we've got a record number of kids. Okay, that sounds bad, but what's a record number of kids? 1, 5, 500, 5,000, 50,000, 5 million?
Right. It's still, to say a record number, and it doesn't accurately depict the picture because it's still a very small actual number. The risk to kids, even with this variant, is very, very low. So it's such a small number, they're not reporting it really.
Yeah, but of course, anything more than one. If you had one before and you got two, well, you've doubled it. But again, it's in relation to the population, so kids are very, very unlikely to get it. But until yours does, and obviously that hits home. Paul Seegert from PCS Healthcare Advisors on the show this morning on 700 WLW. Are we going to see health insurance drop your coverage if you refuse to get a vaccine, or simply if you develop COVID, full-blown COVID, and you're unvaxxed? Are they going to go, hey, you know what? SOL. For example, if I check the box and say I'm a non-smoker, I develop lung cancer, and they test and find out that I have nicotine and I'm a smoker, I have lung cancer, they're probably not going to cover me. Same thing, I think in some cases, DUI, for example, or some things like that, in some cases aren't covered. I think, basically this is what the National Football League did. Said, okay, fine, you know what? You don't have to get the shot, but if you get sick, you're going to forfeit a game, you're not going to get paid. This is kind of like adopting the football model, isn't it?
Yeah, I think most likely we'll see these policies where the person wasn't responsible for out-of-pocket costs will expire for the most part. I think it's a bigger stretch to say that we'll get to a point where, because of the whole natural immunity conversation, I think that challenge there could be a real hurdle to overcome in terms of actual surcharges being attached to plans and premium. But I definitely believe we're at a point now where insurers will certainly not cover your out-of-pocket or waive that responsibility for you, knowing that you could have taken a step to get vaccinated. It's been out there. If you want it, you can get it. It's free, and it would prevent you from, with a very high percentage, prevent you from having the need to be hospitalized. So I think we'll definitely see that.
Could they make a case in the extreme here and go, okay, well, for example, I haven't had a tetanus booster. And I get cut, I develop tetanus. Or maybe I get the flu, and, 50,000 people a year, roughly 50,000 die from complications of the regular seasonal flu. And flu shots are readily available. Could they extend that argument to that? And if so, the inverse is true, right? It's like, well, you don't come at me because I don't have a flu shot or a tetanus booster or, I don't know, rabies or whatever it is. And I got bit by a dog, I developed rabies. That's going to be pretty expensive too. If you're not dinking me on that, why come after me on COVID?
Yeah, I think you're making a good point, and that's why I think the most likely outcome is that the waiving of the out-of-pocket expires, surcharges likely do not happen, and will continue on. The other reality is that since the Affordable Care Act kicked in, we put insurers in kind of a cost-plus scenario where they have to spend 85 cents for every dollar in premium they take in on claims. They get to keep 15 cents. There actually is a somewhat perverse incentive for them. They do better when claims costs go up. So are they really going to fight hard to penalize and do some of the things that we're talking about? Probably not. They're just in a debit accounting position. If claims rise as a result, the insurers actually do better. So we haven't set up the system in a way that they're really motivated to control costs.
So it's good for when we die, it's good for the insurance companies. Or I guess when we get really, really, really sick and recover, probably.
Slowly, yeah,
die slowly, not immediately. It's better. How the hell does that work? Doesn't that, Paul, violate every business model ever? That you're assuming all this risk. How do you make more money the more you use? I don't understand it. It should be the opposite.
Well, we basically turned them into utilities. I was talking to somebody here in the last couple of days, and they said, we could compare this to utilities. Yeah, we could. I mean, they just they get to keep a certain percentage, so they do better if rates go up. They're not incented to operate efficiently and so on. And we've done the same thing with our insurers. There's 5 of them left. They do incredibly well because they do better when claims costs go up. It's not like your car insurer where your interests are in alignment with your insurer. They don't want you to get in an accident. You don't want to get in an accident.
Yeah.
Healthcare doesn't work that way, unfortunately.
It's the opposite.
And that's something we should
So
fix.
what you're saying is insurance companies want us sick.
Yeah. I mean, from a cost standpoint, from a spreadsheet, yeah, they do better when claims costs go up. That's why.
It's kind of mind-blowing to someone dumb like me, isn't it?
I'll tell you, I had an example recently that illustrates the point pretty well. There's an employer in the middle of in Dallas where you could go to 10 different places and get an MRI, all in network, agreed to by the insurer. They negotiated the rates with these various providers for that service, considered it an in-network service, and you pay your $100 copay. But what you don't see going on behind the insurance payment model is that low-cost facility of the 10 would turn around and bill the health plan $700. The high-cost facility would turn around and bill the plan $7,000, all in network. Why would an insurer agree to that? Because it's in their interest.
So
you have to laugh or cry when
you really do, because now I think of the whole model and go, all right, we kill ourselves largely with a knife and fork. We have these vices, and I wonder if the insurance companies are behind us because they're the ones getting rich off of us not taking care of ourselves.
Yeah, it does make you scratch your head when you look at their stock prices since the ACA. I mean, they were the biggest outspoken enemies of the passage of the ACA, but I think through the process they realized, hold on a minute, they picked up 30 million customers for a product they can, with the financial mechanics that we just talked about, and they provide less coverage, they charge more, and they're in a cost plus model now. So now that when this most recent challenge to the ACA occurred at the Supreme Court level, there were briefs written by these insurers as to why it should be left alone. It's been a boon to them.
Well, I guess now I know why the people that I know that are in the insurance industry, why they're incredibly wealthy. Because I was like, man, it seems like you guys would be paying out a lot with COVID and everything. No, actually, we're making more money than ever before. Well, how's that possible? Well, it's the cost plus model that you're talking about. Paul Seegert from PCS Healthcare Advisers, mind-blowing right there. The sicker we get, the more health insurance companies make, unlike any other model ever. Usually it's the more you use, the more it costs them, but not in this case. So, bottom line on this one, are we going to move to a point in the near future where health insurance drop you or simply not cover you if you get COVID and you're unvaccinated? I'm guessing based on what you just said, the answer is not only no, but hell no.
Yeah, I don't think so. They don't want to give up those customers.
Yeah. Keep us alive as long as possible. And it should be a slow death, not a quick death. So death and taxes and death. Paul, all the best to you at PCS Healthcare Advisors. Thanks again for coming on the show. Be well.
Thanks for having me.
All right, anytime. There you go.